Hello, my name is Jason Metcalf. I'm a Vice President of Internal Revenue Cycle Operations with Common Spirit Health. Today I'm going to be covering Section 2.4 Health Plans of the CRCR program. In this section, we're going to discuss the basic billing rules for major health plans, an overview of basic billing features and benefits, and an overview of basic billing rule types. Many people under age 65 receive health insurance through an employer. Others buy their insurance through an individual insurance market or insurance marketplace, also known as the insurance exchange. That was created by the Affordable Care Act. In addition, there are federal and state health insurance programs available to qualifying individuals. Medicare is a government-sponsored program which is financed through taxes and general revenue funds. Medicaid is a federally aided state-operated program to provide health and long-term care coverage for low-income individuals or families. TRICARE, formerly CHAMPUS, is the healthcare program of the United States Department of Defense and Military Health System. Indian Health Services, or IHS, is an agency within the Department of Health and Human Services which is responsible for providing federal health services to Native Americans. The Blue Cross Blue Shield brands are the nation's oldest and largest family of health benefit companies and the most recognized brands in the health insurance industry. Commercial indemnity plans cover almost all services without authorization requirements. A self-funded plan is where the costs of medical care are borne by the employer on a pay-as-you-go basis. Liability coverage includes things like auto, home, or business insurance that may include medical coverage when there's an accident or an injury. Managed care is comprehensive healthcare plans that attempt to reduce costs through contractual agreements with providers and through care management initiatives. The Medicare insurance program has features unique from other health plans. It's a government-sponsored plan and it's financed through taxes and general revenue funds. Medicare Part A, those benefits provide coverage for inpatient hospital services, skilled nursing care, and home health care. Medicare B benefits are available for outpatient and professional service coverage, but the beneficiary must pay a monthly premium for additional coverage. Medicare Part C is known as the Medicare Advantage plans, and this is a type of managed care plan that includes both Medicare Part A and B benefits, but it may also include the Part D benefits. And Medicare Part D is prescription drug coverage program. It consists of private insurance plans that are reimbursed by the Centers of Medicare and Medicaid Services, or CMS, for benefits provided to Medicare beneficiaries. Beneficiaries may enroll in a prescription drug plan or a Medicare Advantage plan, a Part C plan, which may also include a prescription drug benefit. The Medicare Part A benefits consist of benefit periods. The beneficiary remains in the same benefit period until he or she is hospitalization free and or skilled nursing care free for 60 consecutive days. A deductible is due each time a beneficiary is readmitted after remaining hospitalization free and or skilled nursing care free for 60 consecutive days. Medicare uses the concept of a full coverage period for payment. It will pay full benefits for up to 60 days in a benefit period. The full days, those 60 days, renew with each new benefit period. After 60 full days are used in the same benefit period, the beneficiary has 30 coinsurance days. When a beneficiary uses coinsurance days, a daily out-of-pocket expense equal to 25% of the current deductible amount is due from the patient. After the 60 full days and 30 coinsurance days or co-days are used, the beneficiary may opt to use 60 lifetime reserve days. The daily out-of-pocket for each lifetime reserve day is used is 50% of the current deductible amount. Lifetime reserve days are used once in a lifetime and never renew. After 60 full coverage days, 30 coinsurance days, and 60 lifetime reserve days are used, the beneficiary qualifies for no further Part A benefits. If the patient has Part B coverage, Part B can be billed for services covered in the outpatient environment. Medicare Part B is financed through beneficiary premiums and general revenues. It provides coverage for physician services, outpatient services, and other health professions. Medicare Part B has an annual deductible, and the beneficiary is responsible for a co-insurance payment for all Part B covered services, excluding diagnostic laboratory services. Co-insurance amounts for services paid under the Outpatient Prospective Payment System, or OPPS, are determined by the federal regulation and changes as the OPS payment system is updated each year by CMS. Hospital and inpatient and outpatient services are submitted to Medicare and Medicare Advantage plans electronically using the 837I format. UBO4 is the paper format. Physician services is submitted electronically using the 837P or professional format. The CMS 1500 form is the paper equivalent. We'll talk more about this in course 3.5 in the section called Claims Form Requirements, Edits, and EDI for more information. The patient's Medicare Beneficiary Identifier, or MBI, must be provided on an 837I and 837P to Medicare or a Medicare Advantage plan. The MBI is a number issued by the Social Security Administration to individuals or beneficiaries who are entitled to Medicare benefits. The beneficiary's applicable deductible or coinsurance amounts are billed to the patient's secondary health plan or to the patient as appropriate. Section 2.5, Health Plans Managed Care, will provide more information about Medicare Part C Medicare Advantage plans, which replace the Medicare Part A and B traditional plans. To be eligible for Medicare reimbursement, claims must be filed within 1 calendar year of the date of service. Medicare systems will reject or deny claims that are not received within the specified time requirements. Medicare Advantage plan claims must be filed within the specific health plan's qualifying time limit period per the provider contract. When a claim is received by the Medicare Administrative Contractors, or MACs, or a Medicare Advantage plan, the claim is either paid or denied. If the claim is paid, an explanation of benefits notice, or EOB, is sent to the patient. If the beneficiary requested hospital insurance benefits, if the beneficiary hospital insurance benefits are requested, but no payments can be made, for example, not medically necessary services were provided to a Medicare beneficiary where an ABN was issued, a disallowance letter is sent to the beneficiary. In incidences where the beneficiary receives an EOB or a disallowance letter, the correspondence includes a description of the appeal rights or instructions on how to request a reconsideration of the determination. Medicaid. Medicaid is a federally aided, state-operated, administered program to provide health and long-term care coverage for low-income individuals or families. A state may elect to contract with other health plans to offer one or more Medicaid managed care plans as an alternative to traditional Medicaid coverage. Eligibility for Medicaid benefits expanded effective January 1st of 2014 through a provision of the Patient Protection and Affordable Care Act, or the PPACA. As states were provided additional funding if benefits were extended to individuals under 65 years of age with incomes up to 133% of the federal poverty level. In addition, for the first time, low-income adults without children are guaranteed coverage through Medicaid. Not every state is elected to expand Medicaid coverage in this manner. To participate in Medicaid, federal law requires states to cover certain groups of individuals. Low-income families, qualified pregnant women, children, and individuals receiving supplementary security income, or SSI, are examples of mandatory eligibility groups. States have additional options for coverage and may choose to cover other groups such as individuals receiving home and community-based services and children in foster care who are not otherwise eligible. Medicaid programs cover the following services: inpatient and outpatient hospital services, physician, midwife, and nurse practitioner services, nursing home services for persons age 21 or older, pregnancy-related services, family planning services and supplies, laboratory and x-ray services, and federally qualified health center and rural health clinic services. Medicaid hospital claims are submitted using the 837I electronic format, and professional services should be billed using the 837P electronic format. Other forms may be used as mandated by individual state programs. Medicaid in general follows the uniform billing requirements for each bill type. There are some specific billing rules for Medicaid. In addition to the general guidelines, Medicaid has some specific billing rules that must be followed to ensure appropriate payment. First, the form must include the patient's Medicaid case number. Some persons are eligible for Medicaid only after they've incurred medical expenses that reduce their income, called a spend down to Medicaid. Others incur a spend down amounts are reflected on the 837I using a value code 66. Medicaid only makes payment for covered services after any other available third-party benefits are exhausted. Medicaid payments are reduced to the extent that there are benefits available from any other third-party resource. The typical exceptions are specialized children and rehab services sponsored through state programs. Prior payments must be included in the form locator 54. Claims for Medicaid recipients enrolled in health maintenance organizations or HMO programs are sent to the designated HMO carrier for payment, and all HMO coverage criteria must be met. The following services require special documentation that must be submitted with the claim. Those services include induced abortions, sterilizations, hysterectomy services. Newborn bills have to include the birth weight, and state-specific requirements must be followed. TRICARE. TRICARE is formerly known as CHAMPUS, and this is the Uniformed Services Healthcare Program for active duty service members and their families, but it also includes retired service members and their families, and members of the National Guard and Reserve and their family survivors, and others who are eligible. TRICARE Prime is an HMO-type program where military treatment facilities are the principal source of the healthcare. There is a point of service option, or POS option. This program covers active duty military and their families. TRICARE Prime Remote, or TPR, is a managed care option similar to TRICARE Prime for active duty service members and their eligible family members who live and work in designated remote duty stations in the United States, which is 50 miles or an hour drive time from the military treatment facility. TRICARE Prime Overseas. That's a managed care option for active duty service members and their command-sponsored family members living together in non-remote overseas locations. TRICARE Prime Remote Overseas is available in designated remote overseas locations for active duty service members and their families. U.S. Family Health Plan. It's an additional TRICARE Prime option available through networks of community-based, not-for-profit healthcare systems in 6 areas of the United States. TRICARE Young Adult. This is a managed care option for unmarried adult children who have aged out of regular TRICARE coverage. Individuals must be at least 21 but not yet 26 years of age. Not all who qualify for TRICARE Young Adult qualify for the Prime option. They may qualify for TRICARE Standard and Extra. TRICARE Standard and Extra fee-for-service plans are available to all non-active duty beneficiaries throughout the United States. This program includes outpatient deductibles and coinsurance requirements. The type of provider seen determines which option is used. When visiting a non-network provider, the standard option is used. The extra option is used when visiting a network provider. TRICARE Standard and Extra plans. TRICARE Standard has an overseas plan. This provides comprehensive coverage to active duty family members, retired service members, and their families, and all others who do not or cannot enroll in TRICARE Prime overseas. TRICARE Extra is not available in overseas locations. TRICARE Reserve Select. It's a premium-based health plan available worldwide to selected reserve members or Ready Reserve and their families. TRICARE Retired Reserve is a premium-based health plan for qualified retired reserve members and their survivors. TRICARE Young Adults provides comprehensive medical and pharmacy benefits for unmarried adult children who have aged out of regular TRICARE coverage. All dependent adult children who qualify for TRICARE Young Adult can choose this option for comprehensive coverage. TRICARE for Life is a TRICARE supplement to Medicare program. This program is only available to Medicare-eligible individuals who are also enrolled in Medicare Part A and Part B benefits. Unique billing requirements for TRICARE are billed by the means of standard billing requirements using the 837I for hospital services and 837P for professional services. A beneficiary's liability is determined by the program option that the patient is using. Emergency services are always billed separately from inpatient claims for TRICARE. Bills must be submitted for payment within 1 year of service or discharge. If TRICARE is the secondary payer, the claim must be submitted within 90 days of receiving payment from the primary payer. TRICARE deducts a 10% penalty if prior authorization is not obtained when required. IHS is an agency within the Department of Health and Human Services and responsible for providing federal health services to Native Americans. The provision of health services to members of federally recognized tribes grew out of the special government to government relationship between the federal government and the Indian tribes. It is the principal federal healthcare provider and health advocate for Native Americans with the goal to raise Native American health to the highest possible level. When services are not available in an IHS setting, services can be obtained from other providers. This can include hospital, physician, and outpatient care. Claims are submitted using the standard guidelines using the 837 IRP. Federal legislation requires the Medicare participating hospitals accept Medicare-like rates as payment in full when providing services to IHS beneficiaries. IHS is always the payer's last resort. Patients must exhaust all other healthcare resources from other health plans, state programs, and other federal programs before they can use IHS. These programs usually require a purchase order like an authorization to pay for services and require 72-hour notification for ER services. Blue Cross Blue Shield. This is the nation's oldest and largest family of health benefits companies and most recognized brands in the health industry. Over 75 years ago, Blue Cross started by ensuring prepaid hospital care to Texas teachers and providing physician care to lumber and mine workers in the Pacific Northwest. Blue Cross Blue Shield is a franchise company. Claims for hospital services are on the 837I and professional are under the 837P. Blue Cross utilizes central clearinghouses for all claims for Blue Cross plans. The alpha prefix that is part of the patient's ID number identifies the specific Blue Cross plan and must be included on the claim or the claim will be rejected. Commercial indemnity plans. These plans cover all services without authorization requirements and normally without specific billing rules other than the standard billing requirements under the 837I and 837P. Indemnity plans usually reimburse a certain percentage of charges after the patient meets the policy's annual deductible. A fee-for-service plan may pay 80%, leaving 20% to the patient after the deductible is met. Most have a patient stop loss or maximum they have to pay each year, like $2,500 or $5,000. Traditional Medicare is the largest indemnity plan in the United States. Self-insured plans. These are also called self-funded. The employer covers the cost of medical care on a pay-as-you-go basis. The employer determines the benefits and the coverage. They typically have a stop-loss provision to protect the employer from catastrophic claim losses. The employer may use a third-party administrator or TPA for the processing and paying of claims. This can be a two-step process, checking eligibility with the employer and then forwarding the claims for processing at the TPA. Self-insured plans fall under the Employee Retirement Income Security Act, also known as ERISA, and are not controlled by state legislation. State legislation provides guidance for coordination benefits, or COB, determinations for dependent coverage based on the birthday rule. Birthday rule is when parents both have plans and the dependent under the primary insurance is based on the parent's birthday month and day earliest in the year. If parents share the same birthday, the plan in effect longest is primary. Self-funded plans under ERISA are able to follow the gender rule, which may mean that the father's plan is always primary. These claims may not be processed according to state clean claim and clean claim statutes or interest rules. Liability coverage. An auto, home, or business insurance plan may include medical coverage clauses in cases of accident or injury. Healthcare facilities bill liability claims when the healthcare services are a result of an accident or injury, for example, workers' comp, auto, or third-party liability. Complete information that must be obtained includes date of the accident or injury, location including state, responsible party, liability policy information, and appropriate condition and occurrence codes are required to identify the correct liability. Medicare regulations allow for conditional payment claim to be billed after 120 days of pursuing the payer, but the claim to the liability carrier has to be withdrawn. Medicare will then pursue payment recovery from the liability insurer. Patients can also select commercial or smaller government-funded health plans, some of which include Indian Health Service is the principal federal health provider and health advocate for Native Americans. Blue Cross Blue Shield is the nation's oldest and largest family of health benefit companies and the most recognized brands in the health insurance industry. Managed care plans are comprehensive healthcare plans that attempt to reduce costs through the contractual arrangements with providers and through care management initiatives, and commercial indemnity plans cover almost all services without authorization requirements. Patients can also select commercial or smaller government-funded insurance plans, some of which include commercial indemnity plans, self-insured plans, and liability coverage like auto and home. These are key points that you need to remember as you're going through this program to be able to do well on your CRCR examination. Now we're going to ask a question from what we've learned. Which option is a federally aided state program for health coverage? The answer to this question is option number 3, Medicaid. Medicaid is for low-income individuals or families. Eligibility for Medicaid benefits expanded effective January 1st, 2014 through the provision of the Patient Protection Affordable Care Act, PPACA, as states were provided additional funding if benefits were extended to individuals under 65 years of age with incomes up to 133% of the federal poverty level. This concludes section 2.4.